in Hermitage, and we're here today to have a Q&A about COVID-19 and Metro's response. First up, we're going to hear from Dr. Alex Jahangir, who's going to give us a snapshot of where we are today.
All right, thank you. Now I'm definitely on. Yes, thank you. Thank you, Councilmember. All right, good morning. Thank you for having me here. The current state of COVID in our city is as follows. There are now a total of 114,777 individuals who've had COVID. Our active cases in our city is 5,714. So we'll give you some reference. In Christmas time, we were at 7,400. In July, we were at 444. This puts us at the 5,714 at 77 cases per 100,000, or 1 out of every 115 Nashvillians is infected. Sadly, even with that high of a number, we are the third best county in per capita active cases right now. 92 counties in our state are worse as cases per 100,000 than we are. If Tennessee were its own country, today, we would be the second worst per capita state in the world, or entity in the world. We are the worst for new cases per 100,000 in the country right now. The state of Tennessee is. And we are, again, as a county, the third best out of the 95 counties. To add to our numbers here, excuse me, let me put more in reference. As I mentioned, Nashville is 1 out of every 115 Nashvillians currently is infected. In the state of Tennessee, 1 out of every 5 Tennesseans is currently infected. There have been over 1 million infections in Tennessee. Some of you have heard about breakthrough cases, so people who have been fully vaccinated who have an infection. There have been about 360,000 Nashvillians fully vaccinated, so 52% of our entire population. Out of that 360,000, there have been 3,394 breakthrough infections currently, so a little less than 1%. Out of the 360,000 fully vaccinated, there have been 7 deaths, or 0.21%. So while, of course, every death is tragic, I think what I want to highlight here is vaccines work, and vaccines work well. The vaccination rate in Nashville is 58.4%, has 1 dose, 52% fully vaccinated. So if you take out those under age 12, 60% of our residents in this city have been vaccinated. In Tennessee, the numbers are 50% and 42%. So Nashville is more consistent with the national average of also 52% being fully vaccinated. The hospitals, as you all know, are extremely full. In fact, they are the worst in this whole pandemic now. There are currently 3,501 individuals who are admitted to Tennessee hospitals, 968 of those people in ICUs. And in Middle Tennessee, so our county and our surrounding county, there are currently 898 individuals admitted, 273 in the ICU. The trend that we're seeing now that we didn't see when we were having these conversations more regularly is amongst children. This past month, 21% of all of our cases in Nashville have been in kids, where the whole pandemic prior to that is 11%. And statewide, 36% of infections are now in children. In our hospitals, currently in Tennessee, there are 79 children admitted, and in Nashville, in Middle Tennessee, there are 23 children admitted to the hospital. But here is what I think we all should be proud of as a Middle Tennessee region. Towards the end of the last peak, the 3 major hospital systems came together and said, we want to keep Middle Tennesseans in Middle Tennessee if they need care. And so we developed something called the Middle Tennessee Transfer Coordinating Center. This is not seen in East Tennessee, it's not seen in West Tennessee, and it's seen almost nowhere else in the country. And essentially what it is, the three systems came together and said, if any small hospital in our region needs a patient taken care of, we will do what it takes to keep that person in our region. Last week alone, 75 individuals from in the Middle Tennessee area, not necessarily just COVID, but anything, were kept within our region. These are people who would have otherwise traveled hundreds of miles for care. And so we should be very proud of our health systems for standing up and doing that. And so the state of this pandemic is tough now. I think that the cure is vaccination. Monoclonal antibodies are there. A lot of people are doing that. And so that's where we are. And I want to just touch on testing and then turn it over to Chief Swan and then really talk more in detail with more of Q&A. But in our city, 1.4 million tests have been administered, and our test positivity rate is 14.6%. If you remember, at one point in June and July, we were at 2 or 3%. So 14.6% is pretty high. Our Kmart location is averaging just shy of 1,200 tests a day now. And our health department, which I'm very proud of all the work, have had over 440 pop-up vaccine and now testing sites since January, and they've vaccinated over 25,000 people. So with all that said, I want to turn over to Chief Swan for more information. Thank you.
Yeah, thank you, Dr. Jahanger. Testing. Test.
Test. You want
Text.
to switch, Chief? This one's still on.
Testing.
Here, why don't you switch?
We play musical
Yes,
chairs,
sir.
I guess. Okay, thank you. Well, from my perspective, being over the Office of Emergency Management, we deal with the city in a whole anytime that we deal with any type of crisis that overtax one entity. And what we have done in the last 74 weeks that we've been dealing with Meharry, I just want to bring up a few thank yous, and our partnership has been very strong with Meharry, of course, Fire and OEM, the Health Department, Vanderbilt Lifelight, Hands on Nashville, our National Guard, and so many other volunteers and a lot of vendors have done so many great things during this pandemic. And I think as we go through all the lessons learned that we have learned from the time that we've been in the pandemic with COVID-19 and now dealing with the Delta variant, the only thing that's been consistent about this has been our partnerships. It's been what we have done as far as our testing. It's been what we have done as far as our vaccinations. Meharry has been, this is our 74th week. When we first started this venture, we all thought that maybe a few months and we'd be out of it. But now, here we are. We said it when we started, we had 3 locations. We had the Murfreesboro Road location, the Kmart. We had Nissan Stadium, and we had Meharry on campus. As time had marched down, as far as we started going into getting out of COVID, we thought that the numbers were looking good. We actually did a methodical withdrawal. We shrunk our footprint, and we left the Kmart location open, and we was hoping to leave it open, through the start of the school year. And then all of a sudden, we ran into the COVID Delta variant. And since then, I just want to give you some just pure numbers of what we've done. The Nissan Stadium testing has been over 153,000. The Kmart location is 76,000, and the Meharry location was 79,000, a little bit more as far as our numbers of testing. But then we had to go back to the drawing board, and now I'm happy to announce that as of September the 7th, the day after Labor Day, we'll be opening another location, and it will be 350 28th Avenue North. We will have a setup similar to what we had at the Nissan Stadium setup, and this will allow us to be able to continue doing our testing and vaccinations. One thing that is gut-wrenching when we look at the numbers, and Dr. Jahanger touched upon that, even though we're doing 1,200 plus testing, our vaccination numbers are in the 40s and 50. And that tells us that we got to do better at messaging, or as it was stated yesterday on the program that was done by all the news channels, and Dr. Jahangir raised an important point. Why are we not getting vaccinated? And that's, the question, to try to get rid of some of the myths and people being hesitant to do it. But I just wanted to talk about our strong partnership and all that it takes to actually put on a center or a site to actually be able to do the vaccinations and do the testing. It is a truly collaborative effort of many parties and a lot of moving parts, but I couldn't be more proud of what this city has done. And if you look at not just Nashville and the testing that's been done there, it's not just Davidson County. 20% of the testing that we do are our neighbors. So we're being good stewards not only of Davidson County, but of Tennessee, period. And that's something I think that is worth noting. Also, even if you look at our nation, there's very few states that are actually doing testing that we've been doing. And the consistent thing, as I stated earlier, that Davidson County has been doing has been testing and vaccinating. And then on the weekends, right now the testing dates and times will stay the same. Currently, we open from 7 to 2. And that will be the same time that will be at the new location. And then with daylight saving time, we'll adjust it to 8 to 3. There's a lot put in place what times that we select. They're selected due to, number one, the daylight savings is also with safety of our staff. We realize that the most important commodity that we have right now is the staffing at these locations, because there's been numerous reports of people being upset and mad. So we got to make sure that we take care of our staff. The men and women that's out there in the heat of the day, they're there 7 hours. If it's 90 degrees outside, then on that asphalt it's 110 plus. Same when it's cold. So those hours are set to help protect their welfare from the environments, as well as having the daylight saving times, because again, they get there an hour before and it takes them an hour afterwards to break down operations. Just again, I want to show the appreciation to where it's needed. And also I want to note that on weekends, on Saturdays, they do have the mobile units, both the health department and Meharry. We're constantly putting out where these pop-up sites are located, but they're going to do a couple of joint ventures, and we will be announcing that, where both the Meharry and the health department mobile units will join together. That way, we'll announce a location so we can get more bang for your buck. But I can tell you though, people are not taking advantage of them. The numbers are very low. So again, that's really what I have, and then we'll open it up for any Q&A. Thank you.
We're going to recognize Councilman O'Connell. If I can find you on the screen. Hang on just a second.
Sit right here.
Okay, you're recognized.
Great. Thank you, Madam Chair. And thank you to OEM and the COVID-19 Task Force for participating in this today. And I'll start by echoing Chief Swan's gratitude. Nashville has historically, throughout the pandemic, been a reference standard for COVID-19 testing, and I don't want to overlook or discount that. It's been an impressive effort overall. I think for today, I understand that Nissan Stadium is back in active use and that there is construction at Meharry, so the landscape has obviously changed since we had all 3 community test centers up and running in a previous phase of the pandemic. Can you help us understand why, though, it has at least, I understand your point about staffing and hours, but from my standpoint, from my constituent standpoint, and I know from colleagues' standpoint, is it at least appeared to have been difficult to add both capacity and additional sites. And can we get just a little more insight into that, please?
Yes, Councilman O'Connor, I want to make sure, did you say that Nissan was up and operating?
I just mean like...
Oh, yes, the stadium.
The
Yes,
stadium.
I got you. I'm sorry.
Yeah.
Yeah, absolutely. Well, yes, and that's a good question. First, when we first started this, we were pretty much the one-stop shop, but we're not where we were when we started this, when COVID hit. We were just an option, a strong option, but you've got your PCPs, you have your pharmacies, you have your walk-in clinics, you have even your Krogers. You have so many different options to go to get vaccinated or to get tested. So the time frames that are set up, as I gave you earlier, it is critical to understand that when these staffing are working 7 hours of actual working time, it is, I would invite anyone to go by there and just spend a few hours. Don't spend 7 hours, just spend a couple hours there and get a understanding. These guys are in full PPE. Again, now we try to do everything that we can to make it comfortable for them. And yes, we have heaters, we have AC units that blow. It's a bunch of moving parts, but still, it's just exhausting. And what we try to do again is make sure that they don't reach a burnout stage. And remember, they're humans. They're not robots. They're not soldiers, even though the work they do, I think we would probably reconsider that statement I just made. But it is just incredible work for them to be able to be out there any more time than what it is. And when we try to alternate times, it's always about staffing. Everybody's dealing with staffing issues. This is the Meharry Medical Dental School. And one of the reasons why we were really wanting to open this week, but due to some logistic reasons and also giving them enough time to staff properly, is reason why we even got delayed opening this week. So it's several reasons.
And then I would say, Councilmember, I think, so as Chief said, everyone was surprised by the surge, right? So you look at your local pharmacies were out of test. Health systems had to rev things up, took them a while. But from somebody who watched operations OEM, I don't think there was a delay in us starting the process of saying, oh, we got to ramp things up. And I think the process of, I know Chief survey here and looking at sites and talking with the state and getting, so I too would love to see something up and going right away, but I would say the operations of revving things up started pretty darn early. I personally called and spoke with the senior leadership of the 2 labs that we use to run our tests, because one of my biggest worries was, okay, we get a test, and some of you probably heard of some of your constituencies, oh my gosh, it takes now 4 days to turn around. Well, that's really not impactful anymore. So even the labs, one of them had to also rev things back up because they had toned things down. So I think this 4th surge has really came up really quickly and it is everyone impacted. So I think we responded as quickly as possible, and finding the location and all was really a Herculean effort. But
no, I appreciate everything that you're saying. I think the biggest thing for me, and I'm sure this is echoing things that we've heard in the community, is what is different about right now than last year, right? Like we had these community test sites up and running during summer of last year, right? And so we had 3 of them, and I don't know how different the staffing is. I think that's what I'm just trying to understand, is not the speed necessarily. It's just what is different.
So a couple of things. I think I understand what you're asking. So regarding staffing, most of these people went back to their day job, right? And so if you look at health systems, I mean, hospitals are now literally not doing elective cases because they don't have the nursing staff and the other support staff that they need. And I know you know the healthcare workforce probably better than some, just by some of your experiences. So part of it is day jobs. Part of it is, we have the blueprint of how to set up sites, so that was implemented pretty quickly. But I think part of it, the staffing issue is not isolated just to the assessment sites, but it's across healthcare. this thing's worn everyone out. 18 months of wearing healthcare workers out. A lot of us have been accosted publicly. And this is not making excuses, but it's just, workforce issues are becoming harder. But to turn up an operation that can do 1,200 tests or more a day is also not something you can do overnight, and I think has been going as quickly as possible. And the moment that the need was recognized, I know we turned it up pretty quickly. I know Chief Survey and I got on the phone. I was like, all right, we got to get going. And he was like, I'm on it. And this was now almost 2 weeks ago. Again, but I asked you also look at the health systems, the pharmacies, and see how quickly they've been able to rev things up. It's also taken some startup time.
No, I appreciate that. I think, again, I hope everybody in here leaves with a shared sense of both the limitations on the workforce and staffing standpoint, but also, we're a Metro Schools family. Our daughter told us that a girl in her class is in quarantine right now. So for every confirmed positive that walks into a Metro Schools classroom right now, that's probably, up to half a dozen quarantines for that. And then every single one of those has to go get a COVID test, and this impacts kids more, right? And so pediatricians are swamped with test requests, and then all of the pharmacies. I mean, we went looking for an off-the-shelf rapid test, couldn't find one at a local pharmacy, right? These kinds of things. So I know it's not just you all, but I do want to make sure that Metro as a whole, the mayor's office, the COVID-19 task force, OEM, that we're all kind of, we're recognizing that this is a surge, that especially among parents,
Absolutely.
There's a demand
And
out there.
there's one more thing I just want to highlight that we did, and you know this, but I'm just so everyone who's watching it. One change we did while the big drive-through test sites are revving up is Ms. Franklin, who's over there who runs our Bureau of Emergency Preparedness in the Department of Health. All our pop-up sites, which I mentioned that have done 25,000 vaccines, has brought tests there, right? And so that has helped some, right? We've done, easily between 500 to 1,000 tests a week now at those sites. I went to Plaza Mariachi and just sat in the back and watched them. I think it was last weekend or 2 weekends, I don't remember exactly. And literally, I watched them vaccine, and I watched testing, and I think to your point, Councilmember, a lot of the testing were in kids in schools, and it's a problem, but just, there you go. So thank you.
And I would add one more thing. This is important, I think, that we've seen too with the surge. Because of the requirements now to have shown that you have been vaccinated, these concerts, Bonnaroo, Rolling Stones, Dave Chappelle, all these concerts that are coming, people were trying to quickly get their vaccination or quickly be tested to show that they've had these. So we got a big surge. And last point, our National Guard has really played an important role with helping us now. Due to the hospitalization shortage, they're now dedicated to the hospitals, and we won't have them to help us at this new location because of that, as we stated about being overtaxed and burdened. So again, we all feel the same crunch. But thank you, Freddie O'Connor. It's a great question.
Councilmember Henderson.
Thank you, Councilmember Evans. My question is about testing as well and just kind of communication around that. So I appreciate we've got the new center coming online, or the site. But, I have heard some feedback from constituents when we were just down to one site, even kind of with the pop-ups, wondering, how long they're going to have to wait, how long the tests are going to take, not really understanding, myself included, sort of the protocol of, my child has the sniffles or sore throat. Should they stay home for a few days and then I should test? Should I go get the test today? And so I want to encourage, in addition to, there's this site at these times, that we're providing, whether through, the health department or just, resharing CDC stuff. I think there's a lot of kind of fits and starts and questions about what to do, and should I go to Walgreens, and kind of along the lines of what Councilman O'Connell is saying. So I think, I have continued to be somewhat concerned. I've expressed this several times before, Chief Swan. The blue graphic with white all caps, yellow all caps, teeny red, light blue, that graphic about the testing vaccination site, it is very difficult to read and to understand. Are these community assessment centers? What is a community assessment center? Is it a vaccination site? Is it a testing site? I just feel like there's a little bit of a disconnect. I feel like health department has improved graphically the clarity of what they are sharing. I feel that has not been done respectfully by OEM as far as their communication. So I would just encourage you all to get into alignment on how you speak about sites and how you kind of can convey that information, as well as the supporting information about kind of how and when and so forth. So that's just really more of a statement or request. And then in the question space, I think you've shared, Chief Swan, that, many more people getting tests than getting vaccine. I was able to encourage 2 constituents to get vaccinated at that Farman in the Hall event. And what I heard on kind of feedback from them was they were actually, I think what I'm hearing from my constituency at this juncture is not people being kind of obstinate or political or not wanting to get, but really fear. They are scared to get vaccinated, primarily because of disinformation or misinformation. And so in that same space, I think there are people who are kind of scared to get in their car and get a shot in their car and just sort of park somewhere and wait. So what I heard from these constituents is they appreciated being able to go to a site with which they were familiar, that they were going to be outdoors, that it would potentially be smaller. So if they had a concern or they had a reaction, somebody would be there. So I think, kind of that encouragement language. I appreciate just the facts. This is where we are. These are the hours. But I think, if we look at our vaccination numbers and why we're kind of struggling, we've just hovered around this kind of 50%. And Dr. Jahanger, I appreciate you sharing, because I get this question a lot. You take out under age 12. Yeah. So people that are eligible to be vaccinated, that's 60%. Is that correct?
That is correct.
Okay.
Fully vaccinated.
Fully vaccinated. I appreciate that. So, that's still a pretty big, gap that we need to get there. And I just think that if you have kind of reluctant folks, fearful folks, uncertain folks, that's a space in which that education, the real clarity in the communication, and that encouragement is really important. So if you could just maybe speak to that. Please.
No, I appreciate that feedback. And I think to your point of, 60% again, or 52, we're in line with the national average. Not to say that we need, I totally agree with you, we need to get better. I think your point, your feedback, and I'm looking at Brian, I thought he was in here. He's back there. I think your point, we have taken a lot of the advice over the past year or so, and we've, as you hopefully have seen, we've focused our marketing, changed our PR emphasis, and Brian has some support with social media, and perhaps what you're saying more about CDC recommendations as they change and updating those, and we tried to do that, but your point's well taken. And we'll do that. And again, I regarding the other, I agree with you. People, a lot of it is just being hesitant for very valid reasons, and I mentioned this yesterday at this forum. We just need to be a little compassionate to everyone and understand where their fear comes from. We'll do even a better job at measuring what CDC says. But I would say, I would stay away from being the source of being the medical provider if I'm not the medical provider. Meaning, if there's constituents who are sick, I'd really recommend telling them to go to the healthcare provider. In general, that's just my general MO statement. But to your point, yes, I think we can do better at getting some CDC.
Absolutely, I concur with you. I think it's just more in that testing space specifically. Like, if I'm presenting with these symptoms, when is the optimal time to test? Should I keep my child at home, then I go? And
there are great resources that we can do better at putting out. The CDC site, I have it saved. I always send it to people who ask me, because there's some great CDC info out there. Glad to do that.
Okay, I appreciate that. And then as well, last thing, I know that MNPS has had some testing specific events at some of their administrative buildings and so forth. But I did get the question, and I maybe had a misunderstanding, but there was some contract with Meharry to test in schools previously. Does that continue now, and is that going to come back? Or
I don't believe
what
that's continued.
what was that?
I mean, I'm not speaking on behalf of Meharry or schools, but I don't believe that's continued, right?
No, that particular contract.
This is Patrick Johnson, who works with Meharry and represents, you know, he would have better.
That particular contract ended in June, at the end of summer school, and it was not, there was no new RFP issued. That program is not continuing. I have no idea if it will be.
Okay, I appreciate that. I would just like to have a little more clarity and understanding on what the RFP was previously, what was done for, you know, what the,
I'm sorry, maybe it would be worth to get MNPS to comment on that.
right,
I
like just
really- yeah.
understanding kind of the number of tests at what location, like what
Sure.
were we doing then? Did it work? I understand there was a time
Can you guys
window on it and it ended, but I think there's some concern, again, given all these challenges around testing, that we had it kind of before when maybe we didn't need it as much, but now when we need it more, it's not in place, and are we going to do it again? And Mr. Cash can perhaps,
Would like to do as far as ramping up the program again, but I can speak to is, as the program ended, it was highly successful to mitigate environment and bubbles as possible. And a spike, that would be something that should be done.
okay, and so what's the follow-up then, Dr. Jahangir, on that inquiry? I mean, how are you going to kind of get back to the council about?
Well,
Is
I
that
would
just
say,
in-
I would look at Mike Jameson, who's over there, and ask him to connect MNPS
Yeah,
to you all. I
Okay.
think that's, I just can't comment to it.
understood. Thank you so much.
Yeah, Council Lady Henderson, I'll take that in consideration about the messaging. I thought we were in conjunction with the health and OEM and fire to sort of make sure that the same information was getting pushed out, so
Yeah.
I will revisit that.
I appreciate it. I would just say that graphically.
Okay,
it is-
I understand.
It is very difficult to read. It's got a lot of redundancies. It's just a bad informational graphic, respectfully. And
Okay.
it has been throughout the pandemic, spoken to it several times, but it's hard to read and understand. It's the dark blue graphic with the yellow and the white and the red and multiple fonts and all
I got
caps.
you.
And thank you.
All right, thank you.
Dr. Jahangir has a 5-minute warning on needing to leave, so I'm going to recognize Councilman Cash next.
Thanks. I kind of want to delve into I kind of have those school questions too, and it seems like, even if Meharry is, that contract has ended, I mean, we have nurses assigned to each school, and in many cases, a nurse for each school. So I would hope that Metro Schools is, got a plan to do testing, and I would like to, I guess, to understand what if any testing is going on in the schools, and if any, like, that there's a consistent quarantine policy. And so if we could, I'll reach out to them, but it can be something that we can get for all council members. I think that would be great. And I want to delve into the numbers and cases issue related to kids. I mean, I believe that it is what's happening is serious and different from what happened a year ago. But also, when we talk about percentage, like kids are a greater percentage of cases, well, I mean, the argument could be made that, well, because of school starting, there's more testing going on of kids, and there's more, and there are many more older Nashvillians that are vaccinated and less likely to develop serious symptoms that necessitate testing. So I guess I'm asking, to what extent is it a data thing, and to what extent do we know that the Delta variant is a more serious risk for kids?
So I'm sure there's probably some data stuff in there, but here's the thing. 79 children are currently admitted to hospitals in Tennessee, 23 right here in our region. That was not the case at the beginning of this pandemic. The Delta variant has been shown to be more easily transmissible to kids. And I would say a lot of kids that probably, if these kids were not testing positive, then they would not be in the positive number. So kids can get this. You know, what I don't know, I have 3 kids who are unvaccinated. They're under age 12. And what I worry about is if they do turn positive, what's the long-term impact? I don't know. Nobody knows. And so, but I would say that the ultimate metric that is different is the number of kids in hospitals right now with COVID. And that, to me, at the end, is what matters most.
Thanks. To be clear, I wasn't doubting it.
No,
I
totally get it.
I just
Totally
want to,
get it.
because, you know, there's a
Very
lot,
fair.
there's a lot of talk out there, and I think that
Yes, sir.
the clearer we can be about stuff, the better. I also want to ask about the testing capacity, and I kind of understand the answer to this question some, but want to make sure it's clear, and this might be something that can be clear. So, like, when we have, like, the Kmart that is a drive-through or drive-up center, does that mean if you don't have a car, you won't be served there? Or like, I know that WeGo is making accommodations for folks, but we also have people on bikes, and
No,
I
great.
guess I think could we be clear that it's not only for people in cars, and people that aren't with car don't have to like hunt for an appointment as much as
I think
does that
you,
question make sense?
absolutely, you've answered it, and it's not just, it's a drive-up site, but we've taken many people that walk up, and again, we have a lot of participation with the WeGo and other entities that we use for our homeless and all that will be brought there for testing. So if it's a walk-up or a drive-up, we won't turn anybody away. Matter of fact, you don't even have to be from our county.
Thanks. That might be something that you could include in
Yeah.
information, public information about the.
Thank you. That's,
All right, thank you.
Okay, Councilmember Taylor.
Dr. Jahanger, respective of time, how much time do you have?
I have about 5-6 more minutes because unfortunately there's a hard meeting I have to be at.
So I'll proceed to move to ask my questions at the Health and
I
Hospitals
mean,
meeting.
yeah. Unless you want to ask.
We're going to
ask
have you guys,
questions.
speaking with Mr. Sharp, I'm going to have you guys there on Tuesday. So we can proceed to that. Mr. Sharp, is that fair for
Tom,
you?
who's going to be there? Next week? I don't know, man. I'm on call Tuesdays. I can't commit to that. Would you like to just ask? Because I think it's a question around masks, right? You want to just?
I have several questions, but one is about masks, but I want to be respectful of time.
Okay.
And knowing that I'm going to have a health committee meeting coming up, I can wait for the other questions.
Whatever
But
you guys want. Sure.
All right, next is going to be Councilmember Rutherford. Oh, thank you. Screwed me up there. Let's see.
Sorry about that confusion. This may be what Councilmember Taylor is going to ask, but I think that we need to know ahead of time. We rely upon your guidance and have relied upon your guidance, and I believe that the guidance that you've given over the course of the pandemic has ultimately saved lives, and we appreciate that, certainly. But what we need to know more than anything else going into our next council meeting, because we have mask mandate legislation before us, is what is your recommendation? What is your guidance on indoor mask mandate?
Sure. And thank you for that. And I'll say my answer is consistent with Dr. Wright, who unfortunately is feeling a little under the weather today and would have liked to be here, but he's following his own advice. He's texting me in real time. I don't know if he's watching this or not. In short, we believe mandates so in general, public policy for health policy, we believe mandates such as hours, capacity, mask, and so forth were a very effective tool when there was not a safe, efficient, effective, and easily accessible intervention in place. We now have that in a vaccine. And so because we now have that vaccine for everyone over 12, again, under 12, no vaccine. That's why I believe very strongly that masks in schools are an important determinant to keep kids in school, which I think kids should stay in school. So from our standpoint, from a public policy standpoint, from health, we do not believe such a mask mandate per se should be mandated from a city standpoint, at least from a public health order as council. Obviously your prerogative, but it does not deter people who want to require masks in their businesses. So, for example, Mayor Cooper put in all metro buildings and I think that's his prerogative. Vanderbilt University Medical Center, where I work, has a masks requirement in the buildings. They now also have vaccine requirements, which I think is the prerogative of each business. So we believe from a public policy standpoint may not be as effective as maybe it was a year ago. We also wonder, while this is not, that recommendation comes in spite of what I'm about to say, we also don't know how your compliance is going to get you what you want this time, right? Because the people who are wearing masks are probably the same people who are vaccinated now, for just being honest. All right, and so I've mentioned that to you privately, and others. I've rethought through that. Others in health have also thought through that a lot, and we've talked about it because we want to beat this. Masks work. I wear masks indoors. CDC's recommendations for indoors wear masks. And again, businesses who so choose to want to do that, I encourage them to do that. But I think coming from a citywide mandate at this point may be problematic.
Thank you for that. I appreciate it.
Thank you, sir.
I would like to make one correction. I stated that WeGo is transporting, but WeGo has stopped transporting. We now use neighborhood health for transportation to the current Kmart location. So just want to make that correction. Thank you.
All right, next is Councilmember Welsh.
Thank you, Councilmember Evans. I just have a couple of questions for you, Dr. Jahangir, and then I have some logistical questions for Chief Swan. Are we seeing any new variants on the horizon is one question, and number two, where do we stand right now on booster shots and whether or not we are recommending boosters? How is that aligning with what the CDC is saying?
So there's variants, Lambda, Epsilon, so forth, that are starting to develop, that have developed in other parts of the world. It's suspected they will eventually make their way here. So yes, there are other variants. And then regarding boosters, we follow, so the city will do as the state recommends, because the state is the one who gives us our vaccines. The state will probably follow what the CDC recommends. Currently, immune-compromised individuals qualify for a third shot as part of their original dosage. So for those people, they recommend 3. The CDC panel that meets regarding a booster shot, I believe, is meeting next week. And I know they had one meeting earlier this week, maybe meeting again next week, or the 17th. Thank you. And the President Biden had said on the 20th they were going to recommend everyone who's 8 months out from a vaccine get a booster. The panel has yet to formally recommend that. But as soon as the green light's given to give a booster, if it is given, then of course we will facilitate that in our sites.
Thank you.
And I truly apologize, but I do have to head to this next thing that I'm chairing. But very grateful to all of you for your continued support, and Chief Swan and others will be here. Thank you.
Thank you. Chief Swan, I have a couple of logistical questions. I, like Councilmember Henderson, have a little bit of problem with the graphics that we're using for pop-ups, mainly because they're just a little bit too busy, and I think that in general we need to use more simple targeted terms like testing instead of assessment that people immediately understand. But something that I've heard from some of my constituents is that they don't really know about any pop-up sites until it's too late or it's right on time or whatever. So what can we do to try to better advertise that and get that word out about these pop-up sites?
Yeah, I'm going to have Rachel from the Health Department speak on this subject matter.
So we keep an updated calendar with both testing and vaccination sites specified at covid19.nashville.gov. And as soon as an event is booked, it is added to that calendar. And now we've begun specifying which services will be offered at each site. So I would recommend just checking that calendar often. We sometimes get things booked just 2 or 3 days out. Our vendor will contact us and say, we've got something going on, can you get there? We make it a priority to attend as many as we can, so it might just get on the calendar a couple of days before, depending on the vendor that has reached out to us.
But one of the things that we can do better, and we'll be closer with we have several social media outlets that we can join forces with, and we do a lot of stuff now, but we'll be more intentional just to put out, especially when we do joint ventures with Meharry and the health department, and then about the same question or statement you was making that Council Lady Henderson was making. Again, I apologize about that because I think in the short run they were trying to make it more easy, but I guess that's not the case, and we want to make sure that we are staying in step with things that make it simple, because again, we definitely don't want to make anything more complicated than what it is, and we're going to take a hard look at that and immediately make those adjustments. But we'll do better with just making sure that we flood social media, and maybe we can get more with our local stations as well, and just make it a joint venture all the way around to get information out.
And I think it might be helpful also sometimes just to use the social media to advertise that website, like pop up to covid19.nashville.gov and find out where the pop-ups are or something, so people just know to go there, because those web addresses don't really stick in people's heads very easily, you know. Also, I wanted to know what you feel like we can do both as individual council people and as a council as a whole to help get all these numbers up and increase our vaccination rate and testing. Can we help with staffing issues? What do you see? How can we be the best partner to you individually in our districts and as a whole, as a council, so that we can move all these things forward?
Well, you know, I do want to take a moment just to say, you know, we appreciate everything that the council has done. And in the mayor's office, everyone has really pushed when it comes to the logistics and Jay will tell you this, Chief Survey, and all the moving parts that it takes to make this happen. It truly takes a village. And you guys have been remarkable just by having a venue like this so we can talk, because, again, sometimes we get so concentrated into an area that we can get tunnel vision, and we want to make sure that what we see and what we're trying to portray is truly what you're seeing. And so we try to lead by example from our department, from the fire department, OEM, and other. When it comes time for vaccinations, I mean, I was the first one in line to get mine. I mean, because I've got a wife, kids, family, an elderly sister that lives with me, and I took a sworn oath to protect and serve. And this, to me, this is the best way for me to do that, is by setting an example. But messaging is important, and we'll just work together and make sure that we're putting that message out and make sure it's one voice or one message, I should say. That was one of the things that we did try to streamline, because it was stated earlier that people get information. There's so many outlets now in areas where people can get information. We want to make sure that they're getting facts and information. This is not a political choice. This is about health and science. This is about saving lives, and that's what we try to do every day.
Thank you. And I just have one final question, because I forgot, a constituent asked me, can they get tested and vaccinated at the same event?
Yes.
Thank you.
Councilman O'Connell.
Thank you, Madam Chair. And again, thank you to everybody who is participating today. I know, we are sourcing a lot of questions and concerns directly from our constituents, so it's very helpful to have this opportunity. I guess regarding options, one thing I want to follow up on is I just want to remind everyone, I'm grateful to Councilmember Cash for kind of highlighting the transportation mobility access to these sites. As we grapple, I think some of the surge is just coming because school is back in session, and the metro schools population in particular is extremely diverse and includes a number of students and families who might not have established care or be able to afford services like the Vanderbilt health testing. And so these community centers, I mean, again, this is why I was so glad that we had set kind of a reference standard for testing. So I just want us all to be mindful of that there are some equity issues here in terms of just access to tests. And so, $25 off the shelf for a rapid test can be a burden for some families that might not be the same for others. And that availability is one issue, but the cost and access is another issue. So I just want us all to be mindful of that. I think just in a related sense, we've talked a little bit about masking, and it's actually very helpful to get Dr. Jahanger's perspective on that. We also continue to hear about the importance of ventilation. This might be more of a question for the administration. Is it possible to quantify the HVAC and broader ventilation improvements we've made at Metro facilities and kind of how we are aligning with CDC guidance on that front?
Councilman, it's on. I don't know why it's not working. Councilman, let me check with General Services. I know they have been working on that in my unfortunate absence this past week. And let me confer with their interim director, and I'll have a report back to the council before the end of the day.
Okay, and I've gotten a little bit of information from General Services. It's harder for me to make a determination. I didn't know if that's something that the COVID-19 task force is reviewing, and if we're trying to make sure that Metro as a whole, as a city, is at least from a municipal standpoint getting there. So I'll look forward to that update. I think similarly, and this might fall more into the place where we may need Metro schools to come in. I know Dr. Hildreth has made public comments about ventilation, specifically with regard to portable HEPA filters, and has indicated that cost is one of the principal issues. I have received information from Metro schools suggesting that, at least from their perspective, cost is not the principal issue. And so I don't know, again, if we've got members of our COVID-19 task force kind of asserting the importance of this, and we know we've got money through the American Rescue Plan and other federal sources, I just want to make sure that Metro has a consistent and coherent strategy for tackling the ventilation process. So I don't know if the best bet there is to follow up jointly with both the administration or the COVID-19 task force and Metro schools, but I think it's important to understand, hey, are we actually doing everything we should be doing here? If our own experts are saying this, but we're making a different choice, how do we reconcile that? So I don't know, Mr. Jameson, if that's something we can get a response on.
We will be certain. We'll be certain that is part of the update today.
Great, thank you. Then again, back to vaccination rates. I know Dr. Jahanger mentioned VUMC's policy. I know we've got a Metro indoor mask mandate. Do we at this time, Metro HR, Mayor's Office, COVID-19 Task Force, are there plans to have any kind of vaccination mandate for any portion of the Metro workforce?
I can answer only to the point that as of right now, I don't know what that will look like, Freddie. I know, and we wrestled with that as a department head. I come from a Nashville Fire Department in Office of Emergency Management, and we know very distinctively the difference in what the importance of wearing PPE, because it's sort of in our DNA. Every time we make calls or make medical, we always was wearing gloves, and of course we would wear masks when it was appropriate to do so. And now that if it's airborne, then we pretty much know that that's just part of our uniform now. But it is not. We don't mandate that. We just strongly encourage it with messaging. But that's to be seen down the road, I guess. Rachel.
So there will not be a mandate, but there is certainly benefits not only for health, but for workforce to be vaccinated.
Okay, thank you. And then finally, circling back to the kind of original topic of this meeting, looking at testing capacity and so forth. I guess two related questions. I know Tennessee Guard is involved locally, both in logistics support for area hospitals, but I think I understand that they're involved at the community test center as well. Is it possible to increase their involvement in order to expand capacity? And then could we also comment on the nature of the testing contracts that are out there right now? Because again, I've had some folks ask questions about, hey, it seems like we're spending more on contracts only to watch the capacity shrink, and I want to make sure I understand all that.
Well, the National Guard, as we talked about earlier, we had them earlier because of their mission, but because of the hospitalization capacity has been just overran, their mission has changed, and they will be committed to the hospital, so we will not have them at this new location. Now, that's not because they don't want to be there, but it's because their mission has changed. And then your other question, Councilmember Freddie O'Connor, could you state that other statement that you made or question?
Yeah, I just want to understand money we're allocating for testing contracts that seems to be increasing as testing capacity has scaled back. And I want to make sure I can talk to people in the community who have that question.
Well, I don't know if that's a fact, because basically what happened, everything scaled back in the summer as we seen ourselves coming out of COVID. The numbers were trending down. We did it a very methodical process. Dr. Wright, myself, and others looked at vaccination versus those that was getting infected, and we came up with a formula. And as we seen that we could shrink the footprint to only make sense, we wanted to make sure we could open Metro back up. We gave back the fairgrounds. We also pulled back from Nissan Stadium. Harry was doing some building at their location, so we naturally pulled back there. We had the one location, and it worked out fine, and the numbers were very low. It showed that we were doing the right thing. And then, as we all know, we got overran only because of this Delta variant, and everything got kicked back up. And so I don't think that, I just think that now, as everything's starting to balance back out, the contracts are what they are. As we shrunk, so did the contract. We wasn't paying out the same amount. We did everything again in a systematic, methodical way. But now that it's starting to increase, we just talked about the staffing. To increase that footprint, it takes more, takes more staff, and it takes more equipment, more logistics, and we appreciate the state also supporting. We handed out a package that we gave to you, all the council members, and you're more than welcome can share this with your constituents. It shows what all it takes to actually run a location, and it is a very healthy package that will show you all from point A to B, or A to Z, I'm sorry, of what it takes to run it. So I just think as we are learning about everything. I mean, we learned about COVID, we made adjustments, and then people would say, well, from the health department, or not the health department, but from the standpoint of people saying, well, you don't know what you're doing. Well, we know better. As we know better, we do better. We grow, we shrink as needed. So I don't know if I answered your question, but I just think we're making adjustments as we go.
No, I understand the adjustments. I want to make sure that, from a public transparency standpoint, anybody in this room can go out and say, here is how this contract is working. If people are looking at what Metro is spending money on and they see X dollars allocated to a contract, and then they say, well, wait a second, the local spending amount on that when we have all this federal capacity seems to have increased, and yet we see one community test center that we can go have that conversation in a meaningful way.
Yeah, exactly. And we've been very transparent. And I think, from the mayor's team that he's put together, from Mary Jo and others that really helped us with this process, I think we're very transparent, and everything that we've done and asked for or used is in the spirit of doing the right thing. So it's open book.
Okay, thank you, Chief. I want to be really mindful of time. We do have like 4 more questions I think we can run through pretty quickly. And I'm going to recognize Councilman Parker.
Thank you. I just saw the graphic that was posted about the a September 7th opening of the Charlotte site. That's super exciting. Are these sites open 7 days a week, or is, because it's not in the graphic, which days they're open?
It'll be Monday through Friday, and the times will be, and we run the times all together so there'd be no confusion at all.
Yeah.
And that's one of the things that we try to, as it was brought to our attention about some of our graphics, we want to make sure that we don't have any confusion. The sites will run Monday through Friday, 7 to 2. And then we'll make adjustments with the daylight saving times, but it'll be announced in well enough time to make adjustments. And then also know that due to inclement weather, there's times, as we all know, that we may have to close or something out of the ordinary happened that we have to make adjustments. But we'll make sure that that's in there. Yes, the time will be Monday through Fridays, 7 to 2. 7 to 1. Stand corrected. Thanks, Jay.
Thank you. So I just wanted to note that for anyone looking for an evening or weekend test or vaccine, you will need to go to covid19.nashville.gov and find a pop-up site or one of those special events or something of that nature. Thank you.
Okay, thank you, Councilman Parker. I've got a couple questions. First question is, can we provide official guidance on the Metro website about businesses how they can best protect their customers and employees? And then also, can we provide some updated information on the Metro website about private gatherings and guidance about what's safe for that?
I'm not sure what the health department wants to recommend at this time. CDC obviously recommends masks indoors. There's no current mandates against how many folks can get together, and as far as recommending that businesses require masks and vaccination, I'm not sure how far the health department wants to go into that. We can follow up. I think Dr. Jahangir would have been able to speak to that better.
So, I mean, are you asking, do we want to have, if you're having an event at your house, you want to have masks on?
No, just more like guidance of like, hey, here. Yeah, just kind of, kind of provide some more guidance, because residents got very comfortable with guidance during the last round last year. And so is there more guidance that we can provide because of the inconsistency in information that, I wouldn't say information, but maybe application that businesses are leveraging between what they're recommending for employees versus customers and that kind of thing. And then smaller institutions or organizations don't have a big corporation to get that guidance from. Are we going to provide it where we could point some of those small businesses to it, or link maybe to the CDC page that provides some of that specific information? That's kind of where the question's coming from. Okay, thank you. And then going back to kind of the conversation about Saturday hours, I guess from a capacity perspective, at what point from testing would you have to get to a certain threshold of testing before you'd look at expanding into potentially adding another day or adding another site? And have you all thought about that? And I think that's a Chief Swan question.
Yes, and we're always processing what we need when it comes to testing, and what we need as far as being able to counter the surge. We started out with 3 locations, as you know, and again, as we said, we shrunk them. Now we'll as of Labor Day, day after Labor Day, we'll have 2 locations. If there is a need for a 3rd location, absolutely. We're already in the works of securing a location for that need. We try to make sure that we do everything and have a centralized location. And so we will make adjustments if that need is, if we're hit with that need. And let me correct myself, because I mixed my notes up, I think, here. The times of testing is 7 to 1. And then when the daylight savings time we make adjustment is 8 to 2. So I'm sorry if I confused anyone. 7 to 1. And then it'll be, we'll make those adjustments to 8 to 2. But we're always planning for what's next. And if the need comes where we need a 3rd location, absolutely, we'll have that ready and set up.
Okay, thank you. And then the last question that I had was on when you were referencing the Tennessee Guard and them reprioritizing their focus on hospital issues and things of that nature and not having them for the new site. So can residents potentially, as like I know at the Antioch location, that some of the lanes had to be closed because employees had family issues, around health and that kind of thing. So could residents potentially expect then, if we're faced with the same kind of staffing related challenges at the new site, that they would be looking at lane closures initially, maybe reduced hours? I guess I always like to couch, information to, with residents that it may on the fly change, and we have to be prepared for that.
Well, we're just appreciative of the Guard and all that they've done, but we have Hands on Nashville has been such a strong partnership with us. The VOAD team that we have many volunteers that come out and to assist and help us. So we don't anticipate having, again, we always may have bumps in the road, but when we open up Tuesday, we'll be staffed and ready to roll. And right now, I think the waiting time at the Kmart station is about 45 minutes. And again, we always try to make our adjustments. We cannot help if we get these big surges that come, but for the most part, we want everybody's experience to be as comfortable as possible. We'll do everything we can do to make it fluid and streamlined. That's my promise, but I cannot promise about how long it will take. There's too many variants there, but we'll make adjustments as needed.
Okay, sounds good. Thank you so much for everybody's time today, and thank you for all of your help in managing this surge, and we appreciate it. And with that, we're adjourned.
Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.